get a lot of questions from parents regarding what is typical distress and what is a distress that requires additional attention from a professional mental health provider. And I wanted to share some thoughts on what are some areas that parents should be aware of when it's appropriate for them to seek treatment, whether it's through consultation or calling their mental health provider, so that way they can get additional support for their child. And some of those signs or symptoms to look for is if you're noticing that your child is experiencing ongoing sadness that is more intense than usual. And by that I mean they are crying more often than usual, they're not hurt, they're not able to necessarily explain where some of the sadness is coming from, and you might be noticing that part of that may result in them not wanting to be with their peers, spend time with their family members, things that they used to do, and that's part of that social withdrawal. Additional things that you might notice in your child might be that they are a bit more irritable than usual. By that being, they may have more temper tantrums that aren't age appropriate, things that they didn't used to do. Additionally, some difficulty sleeping, and that might be they're having trouble falling asleep, staying asleep through the night, or they may not want to stay in their bedroom and sleep because that's something that they used to do but are no longer wanting to do. Additionally, some things that might come up might be the child not having much of an appetite. So you may notice some weight loss, things that aren't appropriate for that child. Some problems at school as well, some noticing a decline in academic performance, and noticing that the child may be talking about death or having preoccupation with death, things that have to do with self-injurious behavior as well, and having that increased focus on those things. So some of the things that parents are recommended to do when they notice these signs is to call their pediatrician or their doctor, being able to call their mental health provider if they already have one, and being able to follow up possibly with the school as well to see if they are noticing any of those changes. The most common treatment that would most likely be recommended if your child is diagnosed with depression or you are noticing these different symptoms would be through the use of cognitive behavior therapy, which is also known as CBT, or most commonly referred to as CBT. And within CBT, the therapist would be exploring different triggers, exploring different coping strategies that the child could utilize, and positive problem-solving skills, so that way the child is decreasing some of their symptoms. So there are different things that you can do if you start to notice these changes in your child to be able to provide them the additional support they need, and for you to be able to have the extra support so that way you're able to guide your child and be able to decrease some of their symptoms. So if you have any additional questions or have any concerns, please feel free to contact Persona Neurobehavior Group, and we would gladly be able to either answer your questions and be able to set up an initial consultation, and you can get our information in the phone number or the link below.